Every day, Planned Parenthood workers serve more than 8,000 people in more than 600 clinics across the country. In 2016, nearly 2.5 million people turned to the organization for health care. This came amid increased scrutiny of its leadership in the political arena. Beginning today, those responsibilities fall to Leana Wen, who takes over as Planned Parenthood's new president. She was previously Baltimore's health commissioner, and she's here only on CBS This Morning. Good morning, doctor. How are you?
I'm doing well. It's my first day on the job.
And you're with us. Hey. So you're the first doctor to lead this organization in half a century. What do you plan to bring to the organization from your background?
Well, this is deeply personal to me. I was a patient in Planned Parenthood, and so was my mother and my sister, just like 1 in 5 women in America. And as a doctor, I am proud to lead our organization as we deliver life-saving care to 2.5 million people every year.
And why did your family use Planned Parenthood?
When we first came to this country, my mother didn't have health care anywhere else. And Planned Parenthood was there for her, just as it's there for women across the country to provide cancer screenings, to provide birth control. We do more to prevent unintended pregnancies every year than any other organization.
Did you have any trepidation? You're the mother of a 14-month-old baby, Elijah. You are still a practicing emergency room physician. It has now become such a politicized and such a controversial job. Did you have any trepidation about taking it?
Being a parent has clarified my values, and what I want to do is to shape the future for my son, Eli. And it's a future where all people are treated the same, that all people have the right to health care, and where it's a society where we trust women and we trust all people to make the best decisions for themselves and their bodies.
So were you encouraged after the elections?
Yes and no. On the one hand, we saw people rise up, women, people of color rise up to speak in favor of reproductive rights and access to health care. But on the other hand, less than 24 hours after the elections, the Trump administration came out with new rules that would prevent employers, or actually that would allow employers to deny women birth control coverage. I can't believe it's 2018 and we're still debating birth control. Imagine if we're having the same conversation about vasectomies or about insulin. Women's healthcare is healthcare, and healthcare shouldn't be political.
Well, it is your first day at the job, but you are familiar with the Trump administration. As health commissioner in Baltimore, you've sued this administration twice and won. Given that this is a president who seems to hold grudges and has personal reactions to people directly, how do you plan on working with this administration going forward?
I come to this work as a doctor and not a politician. I'll work with anyone who wants to expand access to health care. For me, it's deeply personal. I treated a woman who waited more than a year before she had a lump in her breast examined. And by the time she got treated, it was too late. She had metastatic cancer, and she died not long after I saw her, leaving behind 3 young children. For me, that's what it's about. It's about saving people's lives. That's the work that we've done at Planned Parenthood for over 100 years. And I'm proud to keep on providing health care and protecting access to that care.
Doctor, you said becoming a mother clarified your values. So many people I've talked to who want to restrict abortion rights said Parenthood clarified their values, and that's why they want to restrict abortion rights. What do you tell those people who have the same parent-based authenticity to their beliefs that you claim?
I respect each person's beliefs for themselves. My problem is if they want to impose their own beliefs on other people. As a physician, I trust my patients. My job is to give medically accurate information to my patients and allow them to make the best choices about their health. I don't think that politicians have any role to play in the exam room in determining people's personal medical decisions. I trust women.
Let's talk about what's been happening at the ballot box. In the midterm elections, you had 7 more governors who are pro-abortion rights were elected, but there were also anti-abortion measures that passed in the states of Alabama and West Virginia. Alabama specifically became the first state in the nation to enact what opponents call a personhood clause in its constitution. West Virginia became the first state to approve a measure stripping the state constitution of any abortion rights restrictions, including an issue about Medicaid funding. What's happening in the states?
We're seeing mixed results, and we are seeing people rise up in record numbers in favor of women's health care. We have more than 25 governors now who are pro-women's health. We're also seeing solidly red states like Utah, Idaho, and Nebraska vote in favor of Medicaid expansion, which indicates that people want more health care, not less. And I strongly believe as a physician that health care has to be a fundamental human right and that women's health care is health care.
So is this argument that Roe versus Wade is going to be overturned, is that hyperbole?
There is a very real likelihood that Roe versus Wade could be overturned in this Supreme Court, which would leave 25 million women, which is a third of women of reproductive age in this country, without access to reproductive rights.
Not Roe versus Wade itself, but essentially some other case that comes through that restricts abortion rights?
Well, there are 15 cases right now that are just one step away from the Supreme Court. And in the last 7 years, there have been 400 laws passed in different states that directly restrict women's access. And I am deeply concerned about this from a public health perspective.
All right.
Well, your first day on the job, you got a lot of work to do, it seems.
Thank you.
But I'm excited to do it.
Yeah,
Thank
I
you.
can tell. Thank you for coming today.
Dr. Leana Wen, thank you.